My people, I will begin this video with this story, a true life story about a woman where I know she's a breast cancer survivor. And her story is interesting because now her son can't tell and say whether she don't hear about self-breast examination. She can't talk say no, she never hear anything like that. You can't explain to her and say now the lecturer for school for university tell them about self-breast examination. She can't surprise me too. I surprised. So now one of the ways they take detect breast cancer early. Say insist herself don't learn her, so you could teach her. Maybe she sabi how to do the self-breast examination. First women now, she said no be her portion. God forbid, everything. She no agree. But after some time, she can't the reason her. They check her. This one way that my son can't tell me this thing. And her son know the two talk. She can't remember her neighbor wife died from breast cancer years ago. And if anything happened to her, her children go blame her. Say she no hear, she no listen. She can't reason them, check her grandchildren, her husband, her children, everybody, family them. She can't change her mind. Now welcome to Think Health, Dr. Neche. Tori never finish. We wanna know we are just the listing. So for this video we go learn steps for breast examination, self-breast examination. And it's very important because our breast they outside, we get access to her. But before we start, we go learn some things about breast cancer. Breast cancer is abnormal tissue growth. Everything they grow under control. But when you come scatter, no get control, it fit kill person, it fit spread, reach everywhere. And at the commonest cancer where women they get, about 685,000 women they die of breast cancer every year. And if it occur at any age, as long as you don't get breast, but the risks they increase as you old, as you age. So the other risk factors we're supposed to say, being a female, say we woman, a risk factor. Men they get them, but no be, they do them too much. If you get family history of any cancer or even breast cancer, or if you don't reach 40 years and above, or any radiation exposure to radiation, as they call them, or you too fat, or you smoke, or you too they drink alcohol, or they use what they call hormonal therapy after you don't finish seeing your menses don't stop. Waiting with the symptoms, how you take no. If you feel any lump or any hard knot where they for breast, or anywhere where they thick, can't they soft normal, suspect them. Or you see say your breast swell up, or you can't they hot, or you they red if you they very fair, or you they dark if you know fair. Check them. Or you, true. Our breasts, no, two of them, right and left, no they equal. But if you see say one become big too much past the other, reason more, suspect if it be breast cancer. Or you see the skin of your breast can't they like back of orange or skin of chicken. Check them. Or your breast just begin to scratch you, you no get reason. We better say you get crocodile for nipple, just like that. Check them more. Now this one of the symptoms of breast cancer. So waiting with self-breast examination. These are the step-by-step method where women would use to check and discover any changes within their breast as early detection, so they will know when wahala dey. You know hard, you know the pain. Now me and you when they watch this video, no only your koro eye you need. We will use our eye, watch am, see am. You go come use your hand, feel am. So now our eyes and our hand we need. And if person know they say, in friend or in pikin fit help am. And this now one thing where no be every day you go they do am. Now only once a month. If you see the menstruate, you see they see your menses. The week after your menses now when you go do the breast examination. So if you see your menses finish today, that week will follow. Now then you go check them. Or if you don't know the menstruate again, you don't stop, don't reach menopause. You go come pick one day in a month where you go, maybe on the first day or the last day, or even that day where they will say happy new month. If you choose that day, they do the breast examination. And what you need now only your eyes, your hand, mirror, bed, and just 10 to 20 minutes of your time. You know hard. Money no day inside. And your hand and your eye where God give you free of charge. So step 1, Step 1 involve your eye. So you go come stand in front of a mirror. Come comot your cloth and bra because in an examination you want check am. So as you stand there for mirror now, go look am. You can't carry your hand, keep by your side. Just stand still, they watch am. So when you put your hand by your side, they watch the mirror. You go check am. E dey equal, na the same shape, na the same skin, any nipple changes, anything wey dey abnormal, wey you no understand, wey dey new, you go check am. Then after, you go come carry your hand put for your waist, hold am tight. The reason be say, when you hold your hand for your waist, your breast muscle go come show more, go come tight. So you go come check again whether they get any changes. After, you go come chest out, lean forward as it dey show for this video now, like this. It go help show whether anywhere dey any changes, go show am better. You come carry your hand, 2 hands, so put for the head. So you go see your armpit, whether they get any change, because the breast tail dey the side of the armpit. We get breast tail, everybody get breast tail. You reach for armpit, so you go come check am. This one na step 1. So step 1 na to look. Stand and look. Then step 2, listen very well. While you still stand there for the mirror, you come carry your right hand, go check your left breast. But before you check am, remember say or know say now the 3 middle fingers, the pad of the 3 middle fingers, very important. You go use press every part of your breast gently. So you can't use your eye, divide your breast into 4. You can't just check them one by one, row by row, whether you feel anything, whether anything get normal. You go feel your breast, it should be like a body. But if you say it hard or something dey together, check them. Then you can't start to go round in circular motion, circular pattern from outside, because you go small until you reach inside. No forget to check under the armpit. I don't talk say breast tail dey that side. You go come check them on that side where you did check before. As you finish checking whether you get lump or anything, you can squeeze the areola and the nipple. The areola na that black thing for those where they dark like me, or those where fair, if it be pink. You come press am, check am whether anything come out. Note the color if anything come out for your nipple. As you don't finish that one, you can't do the same thing for the other breast. So if you start with your right breast, after you can't do your left. If na left you start from, after you can't do the right one. Now step 2 be that. Step 2 is very important because now all the things where you do for step 2, you can't do for step 3. The difference be say you can't change position. You can't lie down, relax, carry pillow, put for your right shoulder. Can't carry your right hand, put for the back of your head. Can't carry your left hand. They do all those things where I don't talk about for step 2. They check them gently in a circular motion, every part of your breast, including your armpit. When you finish that side, you can carry the pillow, shift to the left side, do the same thing, or the other side, depending on which one where you start with. You can squeeze the nipple gently. So, of all these things where I talk, which step hard? Tell me for the comment section below. Type on which one hard or which one confuse you. And if you can notice something they abnormal, like the way you look, you know they normal, or the skin they like back of orange, or you can't get nuts or something with the or any bloody nipple discharge or any abnormal nipple discharge. No time, no give excuse, or no say tomorrow breast cancer no dey spare, you know they show mercy. Carry your bag, even the trinkle money where you get, go hospital. At least when you hear what doctor go talk. And a big hospital you go to, because no be all hospital get facility for it. You can ask doctor whether they call general surgeon or any cancer center or any teaching or federal teaching hospital. They get 5 steps to detecting breast cancer early. Number 1 na self-exam, what we don't talk about. Know your risks. Visit your doctor regularly, and screening and testing. The 5th one where they important now to know when to go for mammogram. If you don't reach 40 years or you know they see your menses again, this one a special X-ray. You know the pain as they show for this picture. You go come carry your breast, you come put them, do special X-ray. You go come out like this. You see as you show say this person get breast cancer. Now so you don't finish, you know hard. So back to the story what they tell you. I thought it's a true life story. So in 2010, she can't start breast examination. 5 years after, she can't notice lump, can't go for treatment, everything. Till today, she dey alive. Even her friend where she teach, one of them, out of them, survive from breast cancer. You see, it's very possible. No one like this video. No one subscribe for free. And no one share, give your people, your mother, them, your sister, your neighbor, your shop people, even August meeting for church. People did die from breast cancer. Breast cancer is real and is avoidable. Tell everybody why they shout them. And no one sure say una they do them every month. Una bye bye. Thank you for watching.